The name of this presentation is Chemotherapy Side Effects and How to Manage Them. This presentation is part of Southeastern Louisiana University's Focused Scholarly Project, a course requirement for a Master of Science in Nursing in the Family Nurse Practitioner path. It is being presented by myself, Jennifer Aldana. Thank you so much for taking your time to participate in my project. The purpose of this presentation is to provide a brief summary of the most common side effects from chemotherapy and ways to manage them. This presentation should take about 20 minutes, and as a reminder, you may stop participation at any time. A common chemotherapy-related side effect is fatigue. That means feeling tired and having less energy, but it's more tiredness and less energy than usual. Some tips to manage fatigue at home is to aim for 3 to 5 hours of physical activity per week. For example, if you were to go with that lower amount of time, the 3 hours per week, that would equal to 25 minutes per day. Even walking 25 minutes per day would help manage your fatigue. If you're having any negative symptoms while walking or exercising, make sure you stop and rest and call your provider if you feel like it's needed. While you do want that physical activity, it's okay to rest, and you should rest, but you don't want to be laying in bed all day. So you can rest, but take little power naps, like 10 to 15-minute naps. Kind of the opposite end of the spectrum. Again, we're wanting to have you rest and exercise, but don't overdo it. Try to maintain a healthy diet and stay hydrated. Avoid junk foods like fast food, sweets, potato chips, and ask for help from friends and family. Another common side effect from chemotherapy is having low blood counts. There are a lot of side effects from medications that can affect other lab work, but I'm just going to focus on 3 types of cells today. That's red blood cells, white blood cells, and platelets. Red blood cells include hemoglobin and hematocrit, and they are responsible for carrying oxygen throughout your body. White blood cells are responsible for fighting off infections. There are 5 different types of white blood cells. We won't really get into that, but just know that the main purpose or function of white blood cells is to fight off infection. Your platelets are responsible for forming clots if you are bleeding. For example, if you cut yourself with a knife by accident, if you're chopping onions or something and you cut your finger, platelets are responsible for rushing to that cut, and it helps to stop the bleeding. On the last slide, we talked about 3 different types of blood cells or blood counts, red blood cells, white blood cells, and platelets. On this slide, we're going to talk about red blood cells. The medical term anemia means low hemoglobin and hematocrit, which are parts of your red blood cells. Now remember, those carry oxygen throughout your body. So if your hemoglobin and hematocrit is low, it's not carrying as much oxygen throughout your body, and it can affect how you feel. Sometimes anemia can make you feel extra fatigued, short of breath, dizzy. It can sometimes cause a fast heart rate or make it feel like your heart is pounding. And it can also cause you to feel lightheaded. If you're feeling any of these symptoms, first you need to call your provider and let them know. They may want to recheck your blood levels. Sometimes hemoglobin and hematocrit can get so low that you would need a blood transfusion. So that's important to let your provider know if you're feeling short of breath, fatigue, your heart is racing, if you're dizzy or lightheaded. If you're not having all of those side effects, and maybe just like a little bit of fatigue, we do want to rest. So make sure you're resting a little bit here and there throughout the day. When you're going from sitting to standing, make sure that you do it slowly. Eat well-balanced meals. And if your fatigue is bad and you really feel like you need some help, don't be afraid to ask your friends and family for some assistance. This slide is discussing neutropenia, which is the medical term for low white blood cells, or low neutrophils. Remember, white blood cells are responsible for fighting infection. So if your white blood cells are low or your neutrophils are low, that means that your body's ability to fight off infection has been lowered. If your neutrophils are below 1,500, in some lab reports, the unit of measurement is different, and it might say 1.5 K per UL. You should check your temperature daily. If you have a fever of 100.4 degrees Fahrenheit or greater, you should notify your provider, especially if you're having signs and symptoms of a cold, you have chills, fever, anything like that. You should never eat or drink unpasteurized products. When you're buying milk, for example, make sure you're looking at the label. It should say pasteurized on it. Avoid anyone you know who is feeling sick. Make sure that you always cook meat, seafood, and eggs thoroughly. Do not clean animal waste or cat litter boxes. Have someone else take care of those. When you're doing yard work or gardening, always wear gloves. And finally, do not handle live flowers or plants with bare hands. These are all ways to prevent infection. You're trying to stay away from bacteria that could cause an infection. This slide discusses thrombocytopenia, which is the medical term for low platelets. Remember, platelets are responsible for clotting your blood. For example, if you are in the kitchen and you accidentally cut yourself with a knife while chopping onions, platelets are one of your cells that help stop that bleeding. So if your platelets are low, there is a chance that you may see blood in your urine or stools. Blood in your urine, it may make it look slightly pink, or all the way up to a bright red. For stools, you want to look for a black color or tarry appearance. Sometimes even bright red blood in your stool. Low platelets can cause abnormal bruising. You may bruise more easily than normal, or your bruises may be bigger or darker in color. And you may have bleeding from your nose, mouth, or gums. If you're experiencing any of these, you do need to let your doctor or your nurse practitioner know. If you have low platelets, way to keep yourself safe and prevent bleeding is gently blowing your nose, using a soft bristled toothbrush, and be gentle when flossing. Prevent cracked lips by using lip balm. Do not use a razor, instead use an electric shaver. If you are a female who is menstruating, use a pad instead of a tampon. If you're suffering from constipation, talk with your provider about ways to prevent that to avoid rectal bleeding. Use extra caution when handling sharp objects. Wear protective gloves when gardening. And do not participate in contact sports. Another common side effect from chemotherapy is nausea and vomiting. Usually before and sometimes during receiving chemotherapy, you get medicines to help with that. The purpose of this slide is ways to manage any nausea and vomiting at home. Some ways that you can do that is, rather than eating your typical three, medium to large meals throughout the day, eat 5 to 6 small meals throughout the day instead. Avoid strong smells. Avoid overly sweet, greasy, and spicy foods. Make sure that you're sipping water, Pedialyte, or other clear liquids throughout the day to avoid dehydration. Avoid lying flat after eating. Take anti-nausea medication as prescribed by your doctor if they've given you some for home. If you feel like your nausea or your vomiting is severe or uncontrolled, please let your provider know. Some chemotherapies can cause diarrhea. Diarrhea are frequent, loose, watery stools, which sometimes will also come with an upset stomach, cramping, and bloating. Ways to manage this at home: avoid drinking alcohol or any drinks with caffeine. Avoid eating high fat and spicy foods. Sip clear fluids throughout the day to avoid dehydration. Eat low fiber, bland foods. This follows something called the BRAT diet, which would be foods like bananas, rice, applesauce, and toast. And avoid acidic foods. That would include foods like oranges, drinking orange juice, tomato juice, eating tomatoes, anything with tomato sauce like spaghetti sauce. Another possible side effect from chemotherapy is constipation. Constipation is when your stools have become hard, dry, and sometimes painful when you're passing them. Usually the frequency of your bowel movements may become less than usual as well. Ways to manage constipation at home is to increase your physical activity, increase your water and fluid intake, increase intake of high fiber foods. High fiber foods would include legumes, which are like beans, most of your fruits and vegetables, whole grain breads, seeds, and nuts. And you also want to avoid alcohol. Another side effect of chemotherapy can sometimes be lack of appetite. Lack of appetite can be caused by many things. It could be from nausea, vomiting, diarrhea. Also, sometimes chemotherapy can affect your taste and give you an altered sense of smell. All of these things can contribute to lack of appetite. It is important, even though sometimes you may not feel like eating, to still eat throughout the day to keep up your energy, especially if you're losing weight and approaching becoming underweight. So some ways to manage lack of appetite: eat as soon as you feel even a little bit hungry. Talk with your doctor or your nurse practitioner about medication called appetite stimulants. Take small sips of drink when eating a meal. Basically, when you are hungry and you're eating a meal, you don't want to fill up on water or milk. You want to go ahead and eat that food. And then if you're thirsty or need a little bit of moisture in your mouth, go ahead and take little sips. But you want to fill up on the food, not the drink. Try to stay physically active. The more active you are, the more likely your appetite is to increase. And when you are eating, especially if you are underweight, you want to eat high protein, high calorie foods. Another possible side effect of chemotherapy is lack of appetite, which can be caused for several reasons. It can be caused by nausea, vomiting, diarrhea, constipation. It could be just because you're so tired and fatigued. It could also be because you've had a change in taste or an altered sense of smell. Um, Ways to manage lack of appetite at home is eat as soon as you feel hungry. Don't wait. As soon as you have that sense of hunger, go get a snack or a meal. If you're not already on appetite stimulants, talk to your provider about possibly getting this medication, which may help stimulate your appetite. When you're eating a meal, you want to take only small sips of drink if you feel like you need those small sips of drink. Basically, we don't want you filling up on your water or your tea or your milk. We want you filling up on the food first, and then take your sips of water. Try to stay physically active. The more active you are, the more likely you are to have an increase in appetite. And finally, when you are eating, make sure that you're eating high protein, high calorie foods, but healthy high protein and high calorie foods. This slide is about the side effect of mouth sores, also known as mucositis or stomatitis. These mouth sores can affect your gums, your tongue, the lining of your mouth, like inside on the inside of your cheeks or the roof of your mouth. And it can cause problems with eating, drinking, talking, and swallowing. Usually it can be painful to do these things if you have mouth sores. Ways to manage your mouth sores at home. Well, the first thing is if it is affecting your ability to eat and drink, you need to let your provider know. So you can make a baking soda and salt solution. After you've made this, you can swish with it after each meal and before bed. The way that you make this baking soda and salt solution is you use half a teaspoon of baking soda, a fourth of a teaspoon of salt. Mix that real good in 2 cups of water, and you're going to swish for 2 minutes every time you do this. If you do this, make a fresh batch every day, throw it away at the end of the day, and do not swallow it. Only swish and then spit. When you're brushing your teeth, make sure that you're doing it very gently and use a soft bristled brush. Avoid using mouthwash with alcohol and avoid acidic and spicy foods. A common side effect of chemotherapy is something called neuropathy. Neuropathy is tingling and numbness. Some people describe it as a painful sensation or a burning sensation. Usually it's in hands, fingers, feet, and toes. Sometimes it can extend up the legs and up the arms. For some people, it only comes and goes, and for some people, it's all the time, 24/7. For this presentation, I'm not going to discuss ways to prevent it or ways to get rid of it. I'm going to focus on, if you have neuropathy, ways to keep yourself safe and to avoid injury. So ways to avoid injury is always wear shoes or slippers. Test your bath water with your elbow or a thermometer to make sure that it's not too hot. Routinely check your hands and feet for wounds. If if your hands and your feet are so numb that you really can't feel them, you may not know if you have a puncture wound or say you've cut yourself. So you want to check every day to make sure that you don't have a wound that could potentially get infected. You want to keep your house well lit to prevent any trips or falls. Do not use area rugs for the same reason. They can cause trips or falls. Um, and clear all walkways from electric cords and clutter. This is the last slide discussing possible side effects from chemotherapy. It is in regard to possible skin changes. Most people who have skin changes have redness, itching, dryness. They're more prone to sunburn, and some people will also get rashes or acne. Ways to manage this at home is to use hypoallergenic and fragrance-free cream after a bath or shower. Avoid taking long hot baths. Rather take warm baths or showers. Basically, if you're using really hot water, that tends to dry out your skin more. Avoid using soaps and lotions with scents and dyes. Do not pick at or squeeze pimples. Keep nails clean and trimmed short. Never use a sun lamp or tanning bed. And wear sunscreen and a wide brimmed hat when you're going to be out in the sun. Thank you so much for being a part of my project. I really appreciate the time that you took to participate. The next slide will show a list of my references that I used to help me with this presentation. After that, you'll be prompted to take the post-test, which is identical to the pre-test, and it should only take you about 5 minutes or so. I used 4 references to help me create this presentation. 2 separate pages from the American Cancer Society, one from Memorial Sloan Kettering Cancer Center, and finally, National Comprehensive Cancer Network.